There's no microphone. Okay. Thank you all for really interesting and stimulating questions. Since we do have cameras rolling, if you wouldn't mind standing up and projecting your voice loudly so that we have a decent chance of getting it on camera. If I get signaled that you can't hear, then I'll repeat the question as best I can. But maybe I'll take the MC's prerogative and ask the first couple of questions. The first one's quite trivial, and that is, what on earth, other than playing with me, do you have to do to get a concussion in golf? No.
That would be it.
Are people getting hit with clubs or with balls? Or?
Clubs and with balls.
Don't play with me. So we've heard a lot about the things that we can do to avoid head-to-head contact and running towards each other like battering rams. But we haven't heard yet about the responsibilities of the coach and accountability of coaches. What does the panel think about licensing coaches, especially those who are in charge of our young children?
I think that one great improvement since I got into college coaching, I can remember coaching for Coach Schembeckler back in the 80s. And in those days, the trainer was hired and fired by the football coach. And so, you know, winning and the pressure to win and having the knowing that as a trainer, your job depended on doing what the head coach asked you to do. And I think at some point there, that changed. And the trainers are hired by the administration, and they answer the administration. And I think today most coaches understand that the trainer and the doctors are really in charge of whether a guy plays or not, how long he is out, all of those issues. So that's been a dramatic change, and certainly one for the better.
But embedded in my question is the idea that coaches would be educated in some way a priori, and that their ability to continue would be contingent upon that.
We're actually seeing that movement. That started last spring at the NCAA level. We wrote into the new NCAA policy that coaches had to be educated, and athletes too, regardless of sport. The Big Ten has adopted that as a rule as well, and we're starting to see other levels of sports take up that charge. And so I think we're starting to see that concept. Whether it's a licensure or just a acknowledgement of being educated and having some responsibility, you know, I think it's pretty similar to what we expect coaches to do, to know some CPR techniques and ACLS training too. So I think we're starting to see that movement. Definitely needed though.
And I think the legislation that's sweeping the country now, there are only 12 states with these comprehensive laws. All the ones in yellow you saw were moving in some direction towards return to play legislation. But that legislation in those states with those laws require coaching education. They can come to CDC and take the heads-up training online or in workshops to satisfy that requirement. But we've only got 12 states who are ready to do that, poised to do that. But I think that as this movement towards concussion prevention expands, more and more states will come on board. I think that's one answer to your question.
Thank you. Questions from the audience?
I have a question back. You're speaking earlier about the culture. You spoke of a good physical by the doctor prior to playing.
Mm-hmm.
My question is, Can we have a little bit more of a definition? Is there a place to go to on a website that would, some parameters that we would make sure that a physician does take as, would help define as a good examination?
So that's a great question, and it's a lot of ways hard to answer because even within the physician community, there's there's a variability in the level of training. Certainly sports medicine physicians have particular training in managing concussions. Neurologists do as well. But I think the bottom line is, but that being said, I know some neurologists I wouldn't want to send patients to for concussion either. It really comes down to somebody who is considering the whole picture. They're not just looking at numbers on a piece of paper. They're taking complete history. They're doing a good neurological history, looking at all the different factors of that person's, their other risk factors. They're doing a good physical examination, which really means knowing how to test the nervous system and having experience in testing it in enough different situations where you know what abnormal is and can compare that to what you see in front of you. So it's not, I can't give you like one particular group of people, but it's a little complex question.
That answers my question. Thank you.
So I'm assuming that, I mean, the best way to eliminate the risk of concussion would be to just eliminate the sports altogether, right? That would be the extreme, right? Money might be involved in that. But I'm just wondering, what is acceptable risk? I mean, do you have a goal that you're looking for? Do you want to reduce the number of concussions to a certain number? I mean, where do you reach a point where people feel comfortable with what's happening on the field in whatever sport it is?
That's a great concern. The first part of that is what is the risk, because I can't say what it should be reduced to until we know what it is currently. And as Coach Carr has said, our sports have evolved over time, and the way he played football versus now is a lot different, and other sports are the same. They've been evolving, and we're getting more and more injuries, and the risks are increasing. But on the other hand, as a neurologist, I take care of patients with Alzheimer's, and I see people, trained to deal with that diagnosis. And of the millions and millions of people who play contact sports, we don't see an epidemic, right? So it's not for the average person, meaning the person who plays youth sports in junior high, some high school, if they can avoid the bad cases like the first case I described. In essence, I would say our sports are safe if played within the rules and with proper technique. So I don't think we'll ever eliminate all concussions, and I think that's sort of a philosophical question. I mean, would you just tell people to stop driving to eliminate car accidents? I mean, it's kind of, I don't think that has much merit. But step one, we've got to figure out what the risk is right now before we can answer that question.
Please. Yes.
I both play and coach hockey, and one of the things that USA Hockey is going to vote on this summer is whether to raise the checking age for youth hockey. So currently checking starts at Pee Wee, which is at 11, and they're talking about moving up to age 13. And to me, that seemed really obvious, like yes, you'd wait on checking. But I was sitting around talking with a bunch of other coaches and referees who said, well, you're just waiting, you're delaying until they get bigger and heavier before you teach them the proper technique to hit. And so I wondered what your take on that was.
Well, I grew up playing hockey as well, so I remember starting to hit at age 11 very clearly. In some cases, not so clearly, actually. So I think on the one hand, I would agree that the younger a brain is, the more it's still developing and the more sort of at risk it is of being injured in that way. That's the neurologist in me. The sports medicine doctor in me realizes that, no, I mean, learning how to hit and avoid hits and how to take a hit. And Coach talked about neck strength. All those things are really important. And so to hold off until they're a certain age and let them go, I think I see that point, that it could be more damage. I think if we had better education of coaches so that they taught the hitting and there was checking, but it was limited. And if it was, the games were officiated like they should be, I think I'd rather start it at 11. That's my own personal opinion, for what it's worth. You have a thought?
There's some data out of Canada from Pee Wee hockey. It was pretty remarkable to us to find that 10% of Pee Wee hockey players in Canada have had a concussion, and half of those are repeat concussions.
It's rather startling. Yes.
Coach Carr, you mentioned about the face mask. It acts like a cage. Or did you mean that it makes a player feel as if they can hit it someone else harder, or is it
Yes.
more productive? Okay, so what about the idea of getting rid of that cage in order to, lower the risk compensation?
Then none of the mothers would allow their boys. But there's been a lot of people in the past 5 or 10 years that have suggested taking the face mask off. But I think that certainly would impact. But one of the real problems when they played without face mask was that when a person went in to tackle, what are you going to do? You're going to duck your head. And that is, if there's one fundamental coaching safety point that coaches make that I've heard more than any other down through the years and that I probably used, is that you always are saying, keep your head up. Don't duck your head, because when you duck your head, there's where the serious injuries occur. So, but that has been suggested by a number of people. I don't think many of them are players.
There's a question over here and then down here.
I have a question for Coach Carr. I'm one of the ER doctors here at U of M, and I actually trained with former player of yours, Chris Hutchinson. So back in the early 80s, really.
Dr. Hutchinson.
So one of the stories he told me was his first time he got into a game. He was a freshman, wasn't a starter, so we were down at South Bend. He goes in, someone gets hurt, he goes in, first part of the game, goes in, and he says he gets hit so hard, he doesn't remember the half. So he stayed in the entire time and can't even recall the entire half of football. So it must have had a concussion, right, Jeff? And my question is, all athletes want to play regardless of, how injured they are. That's just the mantra. Want to play when you're injured, help the team. Do you as a coach, or do coaches in general, tell players that it's okay to sit out, when they get concussed? So I think sometimes, like Jeff was saying, the offensive tackle who was in getting concussed, didn't maybe know those signs or symptoms, didn't know that he could come to his coach and say, hey, I'm feeling a little woozy, and it can be okay. It wasn't a sign of weakness. So
I think absolutely one of the real improvements, and there have been many improvements. I mean, there's many problems and issues that we have because of the size and all the changes physiologically. But I think we as coaches, and certainly the trainers and the doctors who are at practice, who are in the games, and we've been educated to a point where I know when a hit has occurred, if I see it, that, I can very often recognize a concussion myself, or at least the idea that I think there's one. So I think the whole issue is much better for the players. When I was playing, you just got, the part of the game was, if you hit your head or if you hurt yourself, hey, you just keep playing, and I think that's been brought out today. But I think we've gotten away from that to a great extent at any rate.
just about, so Jeff, the educational component, we focus on the organizations and everything. Should education be focused on, coaches to then educate their players to then inform them? Because, U of M has all the doctors and stuff saying there, but the average college or high school has maybe one trainer and a coach.
Right. I was going to make the point that the problem at the high school level is completely different. I've been very fortunate to work with some great coaches who let us do our job. But you know, I know some other college situations where it's not the case. It's dependent on a lot of factors. I think it's better than it was, and it's better in college than in high school. But that's where the problem is the story I told is not atypical. Like I said, I could have picked that out of an average clinic week. High school coaches and, you know, younger coaches that they haven't been educated yet. So that's where we have to focus our efforts, I think.
Down the front and then in the back.
A few minutes ago, there was some interesting question about changing the helmet or maybe some other equipment and what effect that might have on the character of play. We're actually doing that experiment in other places in the world. It's called rugby. And I'm just curious what data there are about rugby, because they're not wearing anything basically, and they're slamming into each other.
The incidence of concussion in rugby is about the same as American football in general. Roughly the same. You know, it's a completely different sport, granted. They don't, you know.
The rules for tackling are very different.
I was trying to draw some kind of comparison, but yeah, but it's about the same.
I was in Australia several years ago at the Russell Crowe, who owns a professional rugby team in Sydney. The Rabbitohs, yeah. No. At any rate, he had called me and invited me to come speak to his team. And I was there for 10 days. And I mean, you know, we had these discussions about the helmets, and of course they don't wear them, and they all believe that first of all they have a better game, and that it's safer, but it's hard to believe that they did.
Yeah, about the same.
Yeah, I'll defer comment on whether or not it's better. But perhaps a more close comparison might be Australian rules football, where there are the sort of head-on collisions and so on. Do you know, are there any data on concussions and traumatic injuries there?
There's actually some very good data, and it's within statistical variance the same. It's all about 7 to 9 concussions per 100,000 athlete exposure, so it's about the same.
There's a question at the back.
Hi, you started to talk a little bit about the bigger problem being with high school sports and with younger kids, primarily because the people who work with them are not trained to the level that the people are that work with college teams or even professional teams. They also don't get the grass that those groups do. And so I was wondering, is there some sort of resource? I was looking at the material about the Heads Up initiative through the CDC, but I mean, I saw that it came out in 97, and as somebody who has kids who play sports, I can honestly say I've heard very peripherally about it. So is there any resource for parents that talks about, you know, ways that you can evaluate the sports programs that your kids are playing, and do they have the appropriate equipment? I mean, are they using helmets that are 10 years old, or is there a way to evaluate, for, you know, as parents in there for you to evaluate the coach? Other resources for that?
Yeah, that's really an interesting question. It's not something that we've included as part of our public materials. There are materials about concussions specifically addressing parents, but there aren't those kinds of, I don't know, suggestions, checklists, evaluation methods to look at your son's or your daughter's sports program in school. I think it's a great idea, and I think it's something maybe the athletic groups ought to take on, because I think it's necessary. We just haven't done it.
I mean, were the case that you described earlier, the young man, is that, I mean, I'm assuming that's a smaller town, and, you know, he's coming a couple hours to see you. What, I mean, did you get the sense from them that, do they have those kinds of resources there? Do they even know about the Heads Up program closer to where they are from?
You know, I didn't ask them specifically if they were aware of it. I would imagine not, just based on how things were handled.
So how does the CDC put that information out then? I mean, how was this released, and to what, who were the target audiences that you sent the information out to?
Whole variety. You saw from that one slide some millions of exposures through the media. Almost all the schools have received materials from us. It's spreading down to the club level, to the community level. We have kits for nurses, for emergency physicians. So we're doing, I think, really a good job getting the materials out there. No, it's not reaching every parent of every athlete, but that would be our goal if we could. I was impressed with the number of kits that we distributed. I think it's a matter of, and this seminar can be part of that, just getting the word out that there are materials targeted towards people who interact with athletes, be they parents, nurses, or coaches, that will really help reduce this problem. So, but it continues. We started this program in 2005, and it's only growing larger and larger, but I think it will take some time before every parent and every coach and every school principal knows about this program and implements it.
I can tell you what we're doing here at the University of Michigan, neurosports educational efforts. We're actually in process right now of developing our sort of educational portal on the web that will include training for all those different levels, but some of the other things you talk about too. We're hoping to have our first module up online in actually later this month.
So I feel like this community as a whole is pretty well educated. I mean, how is that going to reach a broader group that doesn't get the resources that we need in our area?
So that's about marketing, really. You know, not in the classic sense per se, but that's why I'm hoping the Block M will carry some message, at least through the Midwest, and that's a big part of it, for sure.
And our last question from the middle here.
Has the CDC looked at standardized health sports physical that would be required, that form would be required for, high school sports or youth sports that would become a standard? So I'm surprised that a lot of these pre-health physicals that come into places like, outpatient urgent care, physicians, how limited they are with what they ask for.
I mean, in terms of, does CDC provide a set of guidelines for the physical?
Yeah, so finding a sheet saying this is what should be looked at, these are the questions that have to be checked off, and because a lot of the sports physicals that I've seen don't address things like concussions, or have you had prior head injuries, and are you experiencing symptoms of migraines and things to say, where a physician can write that this person is able to play sport, but might be at such and such risk or increased risk, and, so that the coaches or whoever is watching them has an idea of, this is the person I'm going to watch out for.
Yeah, we haven't developed that whole suite of questions that you would want to cover in a typical athletic physical. But I think we've come close to it by producing a form of the heads-up kit for physicians. But those kits are directly looking at what you need to look for concussion injuries, as opposed to a full physical, which would have a whole bunch of other measures to it. I don't know if anyone else is doing that. I would think, NCAA or other groups would or sports physicians would probably want to.
There are PPE form companies, and I've seen some now include questions about how many concussions have you had. I would enter that that's not really all that valuable. I mean, you really have to do a good neurological history to figure out, what the risks are. We have a form at Michigan, at Eastern Michigan, that we use that includes some questions about migraine, headache, and other risk factors, family risk factors, and those things. But I'd like to see it more widely adapted for sure.
Well, I'd like to thank the panel members for an interesting and absorbing afternoon. Please join me in thanking them, but before we do, just a quick note that there are some Michigan helmet cookies out there for your enjoyment, and there is a table with information and some exhibits. Please join me in thanking our speakers.